Good evening. Namaste. I'm Dr. Lakshmi Nagendra, and on behalf of Endocrine Society of India, I welcome you all to today's Endocrine Society of India Facebook Live. So today we are talking about myths, facts, and solutions to some of the myths about insulin. We hope to give you a comprehensive overview of some of the commonly spoken about myths about the insulin. You might have heard it from your neighbors, your relatives, and you might be in confusion that is this true? What do we believe? So, hoping to bust some of these myths today. So, I'm happy to have a very well-read panel of endocrinologists today. So, first, I would like to introduce Dr. Balram Sharma, sir, Professor and Senior Consultant Endocrinologist, SMS Medical College, Jaipur. Thank you for joining
Good
us.
evening, everybody. Good evening, everybody.
We have with us Dr. Sanjay Saran, Associate Professor, Department of Endocrinology, SMS Medical College, Jaipur, India. Thank you for joining us, sir. Next, we have with us Dr. Ajay Hanmantu, Assistant Professor, Department of Endocrinology, JSS Medical College and Hospital, Mysore.
Good evening. Namaste.
Thank you for joining us, Dr. Ajay. We have with us Ms. Cyril Salis, Founder and Director, Nurture Health Solutions, Mumbai, and Advisory Council Member, ISPAD. Thank you for joining us.
Thank you so much. It's our pleasure to be here.
So today we are going to talk about a few myths about insulin, a few solutions to these myths, and hopefully a few facts that all our viewers should be knowing about insulin. So before we start talking about myths about insulin, I would request Dr. Balram Sharma, sir, to give us a brief overview about the actions of insulin.
Thank you, Lakshmi. So before we start this whole discussion, this is definitely required that we should know, or our audience should be aware about what is the actual action of the insulin. So in nutshell, I can say that insulin is an anabolic hormone of the body, which is secreted from the pancreas in the body. And commonly we know that the insulin is that hormone which is required for normal well-being, and I can say that this is required for the survival of a human being, or this is a must for the survival. Actually, the main action of insulin, which is more relevant to the common people, is related to the metabolic action of the insulin, although it has various kind of actions, and the action can be on almost every tissue, every cell of the body. We can say that in the almost every cell of the body, insulin has its action, but the major action is to control the blood glucose level or blood sugar level, in simple words, what we can say. So whenever we are eating something, the carbohydrate are actually converted to the glucose, and this glucose actually goes into the bloodstream, and then because of the action of insulin, this glucose is actually entered into the cells as a source of energy. So glucose is the main source of energy, and only with the help of insulin this is entering into the cells. And after the utility of the energy for that particular cell, whatever excess of the carbohydrate in the form of glucose is available, that is actually converted to the storage as energy source, that is known as glycogen. And the major action of insulin is at liver, at the skeletal muscles, and at the fat tissue, which is known as adipose tissue. So means actually by the help of insulin, glucose is actually converted to the glycogen. Glucose is being utilized as a major source of energy. So for every cell to have the proper energy function, for body to have a proper function, insulin is required. And if you do not have insulin in proper amount, we can say, like in diabetes, in type 1 diabetes, insulin is not secreted at all, while in type 2 diabetes, insulin might be there, but that is not sufficient enough, which is required for the body. The person will actually develop diabetes, about which we will be discussing in coming few minutes. Lakshmi.
Thank you, sir. So insulin, as sir said, is very, very essential for a lot of processes in our body, especially to keep the blood glucose levels in control and for the energy and metabolism in the body. So we'll be talking more about this. So next question is to Dr. Sanjay Saran, sir. So when we prescribe insulin, patients feel that it is a part, it's a last resort in treatment of diabetes. They often feel that there is a personal failure on their part to control their blood glucose levels, and that is why they've been prescribed insulin. So what is your take on this?
Yeah, actually nowadays we are seeing that progressively we prescribe the insulin to the young peoples who just develop the diabetes. So we are starting the insulin in the many peoples who just develop the diabetes or their blood glucose level is not so high, but in spite of that, we are starting the glucose, this insulin along with metformin, hoping that we can prevent the diabetes for the prevention of diabetes. Now, that's the article has come in Nature, I think in 2009 or 2008. From that, we are thinking that diabetes is a preventable disease, or we can say diabetes is curable disease. To cure the diabetes, we are starting the insulin in many of the patients, many of the young patients who are obese. So it is not true that the insulin once started, so it lifelong they have to take the insulin. It depending on their beta cell reserve. If the beta cell reserve is uh, enough, so we can stop the insulin anytime. We can start on the OHA also. So, but the problem in India is that the patients are coming with the exhaustion of the beta cells. So at that time, we don't have anything in our hand after anything in our hand in spite of starting insulin. So we can start only insulin at that time because we know the insulin is the best treatment for diabetes. It can be started at any time in patient with diabetes. So earlier we are starting, we are preserving the beta cells. So later on, if we start the beta cell exhaustion is already there, then only we are starting for the control of the blood sugar and control of the other metabolic parameters. So it is not true that insulin cannot be stopped once started. It depends on the which time we are starting the patients. So many patients are coming. We are starting with basal insulin. So after the starting the basal insulin, within 6 months we see that blood glucose is well controlled, or even they are facing hypoglycemia. At that time, we can reduce the dose, or we can even stop the insulin, and patients are doing well with OHA, simple OHA, only metformin or some other drugs also. So it's not true that once the insulin is started, it cannot be stopped.
Thank you, sir. So, two facts. Insulin, once started, need not be continued lifelong in type 2 diabetes, but is very, very essential in type 1 diabetes. So, there is often a confusion in this. So, in type 2 diabetes, if you're started on insulin, there is a chance that if your blood glucose levels are controlled and you're doing well, you might be taken off insulin and started on oral anti-diabetic drugs. And also, taking insulin is not a sign of personal failure at all. It can be started in even early stages of diabetes for beta cell preservation. So moving on to the next question, Dr. Ajay, this question is for you. So whenever I prescribe insulin to my patients, at least 7 out of 10 patients ask me, is insulin harmful to the kidneys? So can you please elaborate on this?
Yeah, thank you, Dr. Lakshmi, for the kind introduction. And this question is actually very pertinent, and most of my patients also do ask about this. Now, whenever we prescribe any medicine, our patients first ask whether there's any side effect to it. So it's very important for the patients to understand that treatment of diabetes is basically by using drugs or insulin, like sir was already putting it forward. So insulin compared to the medications is the safest one, which is available to us to treat blood glucose levels. Now, that is the reason why even patients who are pregnant or young pediatric, young children also are put on insulin, because the drugs might have some side effect. So insulin is the safest one, and even in patients who are on dialysis, that is on end stage kidney disease, when their kidneys are not functioning as well, it is in these patients we use only insulin, because insulin is the safest option which we have. So this myth about insulin that it is going to cause kidney damage is absolutely wrong or false. In fact, it is going to prevent kidney disease by protecting the kidney from hyperglycemia and the complications associated with such high levels of glucose on the kidney. So it's the other way around. It's going to save and not affect the kidney. Yeah.
So I think this is a problem that all of us face in our clinics. Patients are always worried about the side effects of drugs, but on the other hand, they don't realize what diabetes could be doing to their health. Diabetes itself, uncontrolled diabetes, could be harmful to your kidneys and not insulin. So our enemy is the condition and not the drug itself. So I think this should be put forward very clearly, the risk benefit ratio of all the drugs that we use. So I often tell my patients, if there is no side effect to a drug, that means there is no effect to it at all. So there are always side effects to every drug, but we are looking at the benefits of these drugs over the risk and the great benefit that insulin provides in diabetes, in fact protecting the kidneys when we achieve a good control, should be emphasized to all the patients. So my next question is to Ms. Cheryl. So most of my patients who are prescribed insulin have this one major problem or question, that should I always take insulin before my meal? So some patients, are, busy in their work. They're not able to take insulin before their meals. So do we have any insulins that, people can dose flexibly, in a flexible way according to their meals? Or what is the optimal spacing for all the insulins before meals?
That's a very good question, Dr. Lakshmi, because when people are, if they're especially in the hospital and, because of the poor nurse to patient ratio, sometimes the patients receive insulin after the meals is because, by the time the person comes, the nurse comes to the patient, the person has already had their meal. So they think that that is the right thing to do, is to take the insulin after the meals. And only when we have that discussion with them and, discuss with them, depending on which insulin they are on, what is the time cap to be kept, because each insulin will have a different profile of action and onset of durations, onset and the peak profile. So therefore there are newer insulins now which are there, which has the analog insulins like the fast acting insulin and the rapid acting insulins, which can be taken just before the meal. Though the guidelines suggest that all insulin should be taken before the meal, but in case they are on a fast acting insulin and if they have they have a very busy schedule, then they could maybe take insulin just before the meal or just after they finish the meal. But if they are on a regular acting insulin before the meal, then that has to be taken at least 30 to 45 minutes before the meal, at least 30 minutes before starting their meal. And it also depends on their blood glucose control. So if their pre-prandial or the pre-meal blood glucose levels are on the higher side, then it is advisable that they at least take the insulin before, so that the blood glucose levels start normalizing before the impact of the meal on the glucose levels. So this is a very important thing that we educate our patients on, in terms of which insulin they're taking and when should they be taking it before the meal. And even the premix insulin,
So
because a lot of our patients are on premix, and if they're on a premix insulin which has got short acting or regular acting insulin, then it will have to be taken at least 20 to 30 minutes before the meal.
thank you. So regular acting insulin 30 minutes before the meal, but if you're not able to take 30 minutes before the meal, we now have other insulins which are quite advanced, and you can even take them at the start of your meal and even take
Yes.
them after your meal, 5 minutes after you start your meal. So we can be quite flexible when it comes to dosing and timing your insulin with your meal. So that should not be a hindrance at all. Balram sir, next
And it
question
works
is
very well with
for you.
children and busy people, yeah. Because children,
Yeah.
especially parents, are worried because, the child, you've given insulin and the child refuses to eat the meal, and then you're wondering what to do because you're worried about hypoglycemia. So the newer insulins, especially the fast acting, have really done a world of a difference, especially in this population of patients.
Right. Balram sir, the next question is for you. So many of my patients complain that they have a lot of pain while taking insulin, especially children and the elderly. They say that should I take insulin 4 times? It's causing a lot of pain. So what is the solution to this? And does the insulin injection actually cause pain?
Yeah. So this is really the major inertia or hurdle what we are actually facing in the day-to-day clinical practice. Sometimes the patient might have not even used the insulin anytime, and he might be listening from somebody, or he might be having the experience of the IM injection or the IV injection. So sometimes patient might have the painful memories of other injections before the starting of any insulin. Whenever you are actually prescribing insulin, patient used to say that, Doc Saab, this is quite painful, and can you replace it with any medicine? So my simple answer to this question is that uh, actually there are a lot of medication, but no medication can be actually take the place of insulin. When the insulin is required, as we are having the discussion with other panelists also, then insulin will be the best for you. And as Dr. Ajay also mentioned, that this is the best available medication. Regarding the pain, uh, with the latest development in the science and the discoveries with the and the developments with the needles, with the lot of pain devices and the techniques, these are the most important aspect which actually can actually make the experience of insulin almost painless. I can assume you, or I can assure you, because whenever any patient has the experience of IM injection, that is pretty painful because the needle is a longer insulin needle, the needle is thicker, the gaze is different from the insulin. Uh, the gaze is different from the insulin needle. While in the insulin needle, that is pretty thin needle, and that has a special covering which actually protect from the pain. So they are almost less insulin, and if you are using it with the pen devices and with the proper instruction of the techniques with the diabetes educator or by the doctor himself or herself, the pain is almost negligible. The other thing is, if the technique is wrong, then the pain might be there. The second issue, that if you're not rotating the sides, then also the pain might be there. So if you are actually experiencing pain, then consult your doctor, consult the diabetes educator, whosoever is sitting in the clinic of the doctor. Then with the their advice and with the help of the doctor, the pain will not be the problem with the insulin, I can assure you. And with the proper rotation of the side, with the proper inclination, like at 90-degree angle, you should use the insulin pens, and you should frequently change the needles also. That is one very common problem. Sometime because of the affordability, because of some other issues, or because of the lack of knowledge, the patients are actually not changing the needles also, and that might be creating the pain. Sometime at the time of means recapping the pen, or sometime when they're putting the cap again, they are actually means blunting the needle, and when they are using it on next day, then that might be causing the pain. So these are some practical problems. So if you are actually having some time, or your educator has some time and they're sorting out those problems, then pain will definitely not be the issue, and you can simply use insulin without any fear of pain. Lakshmi.
That's true, sir. I feel that if we show them the first injection in our clinics when we start them on insulin, if we or our diabetes educators show them the first injection, that often dispels the fear of insulin or fear of injections, because often I tell them after I inject, during injection, you should tell me when you feel the pain. And, with the smaller needles that we have, some of them don't even feel it. And they fail to tell me when it was injected. So it is
Yeah,
as painless
most of,
as it can.
most of them do
Yes,
not
sir, please.
actually have the pain, but they have the fear of the pain. Number one. Sometime I have witnessed in my own practice that sometimes the patients are not changing this needle for 7 days or even more than that. And definitely at that time, the needle might be quite blunt, and that might be causing the pain. So these are the practical problems. These are not the real problems. So by the simple explanations or by simple help, these hurdles can be ruled out, and the patient can experience the use of insulin without any painful experience. Lakshmi.
So insulin injections, not painful at all. So I know we have spoken about this already, but Sanjay sir, could you please tell us again that if once insulin is started, is it a death sentence? Is it for lifetime? Is it or is it different in different conditions like type 1 diabetes and type 2 diabetes? And when can we stop them?
Yeah, as we know, in type 1 diabetes, already beta cell exhaustion is there. There's no insulin inside the body, so we have to take the insulin from the outside. It's a natural thing. It's not the something like the different thing like drugs or some other medications. Insulin is a natural thing which is inside the body. Now body is not taking, so we are taking from outside. No? So first thing is that in type 1 diabetes, we don't have any other therapies than insulin. Only insulin we have to take. Second, in type 2 diabetic patient, as I've already explained, that insulin, if we are starting at what time, depending on that, whether we can stop the insulin or not. If we are starting earlier before the exhaustion of the beta cells, then we can stop at any time. Or if we are starting the later on when the beta cell already exhausted at that time, no insulin inside the body, then we have to take the insulin from the outside. So it's a time at what time we are starting the insulin. So better to start the insulin earlier. So we have seen in various trials also that insulin helps in preserving the beta cells. Even insulin, uh, other complications are also likely to be very less with the insulin if we are using insulin along with metformin or some other drugs. Uh, depending on the patient's beta cells reserve, at what time we are starting the insulin. So in most of the patients, we are saying that we are starting the insulin for 1 month. Once the blood sugar will be controlled, then we will stop the insulin. Like that we are saying. But actually, depending on the condition of patient, if beta cell exhaustion is there, the patient is coming, mostly patients are coming very happily that now everything is controlled, we are fine, so let it continue, like that. Sometimes patients are asking repeatedly that, sir, when we are going to stop this insulin. So in many patients, we can stop, but some patients we cannot stop. So at that time, we can say the patient that after 2 months we'll stop, after 3 months we'll stop. Then obviously the patient will realize the reality later on. So it's like that. So depending on the beta cell reserve, we can stop the insulin on the patients which are on type 2 diabetes.
Thank you, sir. Dr. Ajay, next question for you. So many patients when prescribed insulin in pregnancy are very scared if insulin will affect their baby in any harmful way. So what do you have to say about this?
Yeah, again, in conditions like pregnancy, we need to use medications, or we need not use medications that are going to cause problems to the patients. Now, insulin is one particular agent that I've already told is the safest one. And in pregnancy, it is not just the health of the mother, it is the health of the fetus also that we have to keep in mind. And when this is the case, we have to use an agent which is the safest. So, though there are studies which show that certain medications like metformin or glibenclamide may be used, still it would be preferable to put the patients on insulin, because in pregnancy, again, they'll be more, receptive to your advice, because when you tell them the baby might be affected with the drug that you're going to use, they'll definitely understand this and they'll definitely accept insulin. It is to be made clear to them that insulin is a hormone, like sir was saying, it is produced within the body. It is just a supplement that we are giving. It is not a toxin or an external agent as such. So we need to convince the patient in such cases and tell them that it is safest. And there's no, contraindication for the use of insulin in pregnant diabetic or gestational diabetic patients. Lakshmi.
So absolutely safe to be used in pregnancy and not to be worried at all for the health of the mother or the fetus. So my next question is to you, Ms. Cheryl. बहुत सारे पेशेंट्स को ऐसा लगता है कि इंसुलिन स्टार्ट करने से वेट बहुत बढ़ जाएगा. So what is your say on this?
Yeah, I think वो सबसे बड़ा डर होता है सबके मन में कि इंसुलिन जब शुरू करेंगे तो वजन बढ़ जाएगा, which is not true at all. In fact, हमारे बहुत सारे पेशेंट जो इंसुलिन पे है, they're able to manage weight and even lose weight. So the most important thing is कि जो वो इंसुलिन लेते हैं, अगर वो इंसुलिन लेके मतलब खाना कम खाएंगे तो हाइपोग्लाइसीमिया हो जाएगा या फिर लो ब्लड ग्लूकोज हो सकता है, और उसके वजह से they have to eat a lot of sweet or sugar to correct the hypoglycemia, and that is the reason why they could gain weight. So if you are taking, मतलब अगर आप इंसुलिन उतना ही लेते हो जितना आप खाना खाते हो, and therefore now things have changed, जहाँ पे हम कहते हैं कि पहले हम खाना खाते थे इंसुलिन के लिए, अभी हम इंसुलिन लेते हैं उतना ही जितना हम खाना खाते हैं. So that is the most important thing, and therefore carbohydrate counting has become very, very important and prevalent today in our clinical practice. तो अगर हम इंसुलिन सही मात्रा में लेंगे जितना हम खाना खाते हैं, और जितना हो सके हाइपोग्लाइसीमिया या लो ब्लड ग्लूकोज के एपिसोड्स को negligible, if they are as good as not there at all, then there is no reason for the person to gain weight. So the most important thing is to take insulin just as much as you are eating to cover your meal and get good postprandial or post-meal blood glucose levels and prevent any hypoglycemic episodes.
So very rightly said, insulin need not be the cause for your weight gain. Actually, an unhealthy lifestyle is actually the bigger culprit than insulin, and weight can be very well managed with a good lifestyle and exercise regime if you're on insulin even. Balram sir, next question for you. बहुत सारे पेशेंट्स पूछते हैं कि इंसुलिन से क्या हमें एडिक्शन हो जाएगा, इसके बारे में आपका क्या कहना है?
बिल्कुल बिल्कुल लक्ष्मी, तो ये बहुत ही कॉमन एक प्रॉब्लम है लोगों के दिमाग में. इस तरीके का मिथ काफी डीपली सीटेड है. डॉक्टर साहब, एक बार इंसुलिन शुरू कर दिया तो मेरे को तो इंसुलिन हमेशा लेना पड़ेगा, फिर मेरे को इंसुलिन की आदत हो जाएगी, फिर मेरी गोलियां काम नहीं करेंगी. इन दैट वे Means these are the common problems what we are actually facing in day-to-day practice whenever we are trying to prescribe insulin, recommend insulin. ये प्रॉब्लम हमेशा एक बार साथ में आती है. आपको किसने बताया कि ऐसा हो जाएगा? वो सब मेरे कोई रिलेटिव थे, मेरे अंकल थे, मेरा फला रिलेटिव था, उसने कहा था. Sometime means the newer generation might be searching something on Google also, और हियर एंड देयर की कोई इन्फॉर्मेशन कलेक्ट करके एंड दे आर कमिंग कि नहीं डॉक्टर साहब इससे आदत हो जाएगी, इंसुलिन तो मुझे लेना ही नहीं है. एंड दे हैव दिस इज द फिक्स थॉट इन देयर माइंड कि इंसुलिन नहीं लेना है बिकॉज उसकी आदत हो जाएगी. दे हैव टू बी ऑन इंसुलिन अगेन एंड विदाउट इंसुलिन दे विल नॉट सर्वाइव. विदाउट इंसुलिन द अदर मेडिकेशन will means whenever you are starting insulin other medication will be of useless. तो ये बड़े कॉमन मिथ्स हैं. और हमारा आज का जो अल्टीमेटली पर्पस है इस डिस्कशन का, दैट इज टू वॉश आउट दोज ऑल मिथ्स. तो यहाँ पर मैं इस प्लेटफॉर्म को यूज करने की यही मेरी वो है इच्छा कि हम लोगों को समझा पाएं कि इस तरीके का कुछ भी नहीं है. एक्चुअल में साइंस में इस तरीके की कोई नहीं है. वी नो कि इंसुलिन, वी हैव ऑलरेडी डिस्कस्ड इट, दैट इंसुलिन इज अ नेचुरल हार्मोन. ये हमारे शरीर में एक नेचुरल हार्मोन है जो हमारे पेनक्रियास से, बीटा सेल जैसे डॉक्टर संजय बोल रहे थे अभी, उनसे सीक्रेट होता है. और आप जस्ट सोचिए कि अगर हमारे शरीर से कोई चीज नेचर ने डिसाइड किया है, ऊपर वाले ने डिसाइड किया है कि हमारे शरीर में जो बन रहा है हमारे लिए जिंदा रहने के लिए जरूरी है, हमारे सर्वाइवल के लिए जरूरी है, हमारा नॉर्मल बॉडी का मेटाबॉलिज्म मेंटेन करने के लिए जरूरी है, हमारा ग्लूकोज लेवल मेंटेन करने के लिए जरूरी है. ये हम जो नॉर्मल लोग हैं जिनको डायबिटीज नहीं है उनको भी इंसुलिन सर्वाइवल के लिए जरूरी है. इसी तरह जिसको डायबिटीज है उसकी इंसुलिन की कमी हो गई है, इसलिए हमको बाहर से इंसुलिन की हेल्प देनी पड़ रही है. तो उसको एडिक्शन का कोई चांस नहीं है. ये कोई एडिक्शन वाली मेडिसिन नहीं है जिसकी वजह से आपको कोई आदत हो जाएगी या एडिक्शन हो जाएगा. ये कोई ओपियम नहीं यूज कर रहे हैं या कोई और एडिक्शन वाली मेडिसिन नहीं यूज कर रहे हैं जिसकी वजह से आपको इस तरीके की प्रॉब्लम होने वाली है. दिस इज माई कॉमन एक्सप्लेनेशन टू द पेशेंट्स that this is a normal hormone which is actually being secreted in my body, in your body, in anybody's body. And if nature has decided that that has to be secreted for lifetime for a normal well-being of the patient and for diabetic to control or become normal like a normal person, then how the insulin can develop the addictions. So this is a false belief of yourself, or this is purely a myth. You should clearly wash that out. ऐसा बिल्कुल नहीं होने वाला है. अगर आप इंसुलिन लेंगे तो जैसे अभी डॉक्टर संजय और डॉक्टर अजय ने बताया कि जब आपको इंसुलिन की जरूरत होगी, आपके डॉक्टर को लगता है कि आपको जरूरत है इंसुलिन शुरू करना, डॉक्टर की सलाह मानिए, इंसुलिन शुरू कर सकते हैं. जब हमें लगता है कि जरूरत नहीं है, एट दैट मोमेंट वी कैन स्टॉप इट. सो except in type 1 patient, insulin can be started at any time, can be stopped at any time. That simply depends upon your requirement. कभी कभी ऐसा होता है कि आपको कोई टेम्परेरी टाइम के लिए जरूरत है, बहुत शॉर्ट टर्म के लिए जरूरत है, कुछ वीक्स के लिए जरूरत है, कभी कभी आपको लंबे टाइम तक भी जरूरत होती है. बिकॉज अगर आपने बहुत प्रोलॉन्ग डायबिटिक हो गए हैं, आपका बीटा सेल काम नहीं कर रहा है, या जैसे टाइप 1 की हम बात कर रहे थे जहाँ पे ऑटो इम्यूनिटी की वजह से इंसुलिन सीक्रेट ही नहीं हो रहा, वो एक अलग कंडीशन है जहाँ पे आपको इंसुलिन लेना मजबूरी है. बट उस स्थिति में भी इंसुलिन का एडिक्शन नहीं कहेंगे, इंसुलिन की जरूरत है बॉडी को. और बाकी के जितने भी केसेस हैं लाइक टाइप 2 डायबिटीज जो कॉमन डायबिटीज है, उसमें अगर हमने इंसुलिन शुरू किया है तो if the requirement is not there, then insulin can be stopped at any time. If requirement arises, again we can start, again we can stop. So simply, without any hesitation, you can simply start the insulin if your doctor feel like that, without any means the myths or the concept of being the addicted. Lakshmi.
थैंक यू सर. तो इंसुलिन एक जरूरत है और आदत बिल्कुल नहीं हो सकती. करेक्ट. सो Sanjay sir, next question is for you. So when we start patients on insulin, they feel that insulin is going to drill a big hole in their pockets. वो पूछते हैं कि ये बहुत expensive है, मैं नहीं ले सकता. क्या सारे insulin expensive होते हैं? What is their cost compared to other oral drugs?
Yeah, actually, I'm not agree for that. Actually, insulins are not very expensive. There are many types of insulin are there in the market. So depending on the insulin profile, insulin action, so insulin can be a little bit expensive than other drugs, but it's not very expensive. So if we are counting the complications of diabetes, so let's see the simple cardiovascular disease. The patient is having some cardiovascular disease, or he's having some acute coronary syndrome. So I think if he'll go to hospital, the total expenses will be around 2 to 3 lakhs rupees at that time to see whether it is going to for angioplasty or something. Sometimes people may require CABG also, that will cost around 5 lakhs rupees for the patients, and lifelong he has to be with the cardiac medications. Same thing like peripheral vascular disease, the patient is having some diabetic foot ulcer or like that, or he has some other complications like CKD, chronic kidney disease. At that time also he will require many other medications. So expenses of that medications will be much, much higher than the insulin. So considering that thing in the mind that we are taking insulin to preserve our organs of the body, to control our blood sugar, so the complications can be minimized, so our the expenses can be minimized. For that we are taking insulin. So insulin is not expensive if we are seeing a long term time. Or even the regular insulins nowadays we can get in the 400 units, while we can get in 150 or 200 rupees like that. So it's not very expensive nowadays. Or if you are talking about NPH, also same price. If you are taking glargine also we can get in 500 rupees, depending on the dose. If the dose is very high, at that time he can say it's little bit expensive. But considering the other complications and the insulin also, it causes longevity. So if it increases your life, or you can say the better life it increases, not the older one. So considering these all things, insulin is not very expensive. It's the cheapest thing to increase our life, complications free life. It gives us the complication free life without any other kind of comorbidities. So insulin is not very expensive. It's not going to dug in your pocket.
So rightly said, the investing on insulin is investing on better health and investing on good quality health. So in the long run, insulin will help preserve your kidney function, your heart function, and will not only give you, a good financial independence from the complications, but will also give you a good quality of life. So next question is for you, Dr. Ajay. So many patients feel that starting insulin means that there is an inevitable risk of hypoglycemia. So they feel that oral drugs don't cause as much hypoglycemia, but starting on insulin means that you can have hypoglycemias. They are scared of midnight hypoglycemias, and this becomes a deterrent in starting insulin in many patients. So what's your say on this?
Yeah, definitely any agent that is used for the treatment of diabetes comes without saying that there is a risk of hypoglycemia, may it be drugs or insulin for that matter. So all patients have to keep it in mind that there will be a risk, but it is not inevitable. We need to follow certain things to prevent such things from happening, and also be prepared for such an episode if at all it happens. So certain things patients should keep in mind is that they should be very punctual with their diet. They should have diet on time, and they should not, skip meals or delay in taking meals, especially after taking insulin or any drug, because there is a risk of hypoglycemia. And whenever they go out or are driving or are doing any work with a heavy machinery or anything for that matter, they have to keep something like a glucose packet or a glucon-d packet or a chocolate or anything like that in their pocket handy. So whenever they feel symptoms like symptoms or signs of hypoglycemia, like if they have tremors or palpitations or sweating or hunger, or they feel there's an imminent hypoglycemia that is going to happen, they need to take 2 or 3 teaspoons of glucose or a chocolate and try to prevent that from happening. So I would say it is not an inevitable risk, but you have to, keep it in mind and be prepared to prevent it, and also have certain measures to prevent them from happening in future. Yeah.
So very rightly said, hypoglycemia not inevitable at all. We can take many measures to prevent hypoglycemia and lead a good quality of life even while on insulin. So my last question is for you, Ms. Cheryl. So patients, once we start them on insulin, वो बोलते हैं कि अच्छा मैंने अभी इंसुलिन स्टार्ट कर लिया तो मैं कुछ भी खा सकता हूँ. तो इसके बारे में आपका क्या कहना है?
I think that's a very good question that you've asked, because we often get messages from our patients, because they think that it's very easy. I just take extra insulin and I can eat 2 gulab jamuns, or I can eat a pastry, and every day there'll be one new thing that they will add. And, they feel insulin gives them the license to eat whatever they want, which is not true. They still have to eat healthy most of the time. And in fact, if they take insulin and eat it with a healthy diet and lifestyle, they can really manage their blood glucose levels well. And this is very important. And I think today, with the modern insulins that are there, with the new analog insulins, there is no fear of hypoglycemia, because you can take insulin as much as you are eating. So if you're eating a small meal, you can take lesser amount of insulin so that your post meal blood glucose levels do not go low. And but very important is to do this under the guidance of a qualified dietitian, a qualified diabetes educator, and of course with the guidance of a doctor. So this is very, very important. Again, not necessary. There's another myth that if you're on insulin, you have to keep eating all the time. A lot of people will keep eating, and then their glucose levels are usually on the higher side. So again, it depends on the type of insulin that the person is on. For example, if they are on fast acting or rapid acting insulin, then it will only cover that meal. So if they're taking that insulin before breakfast, फिर वो सिर्फ breakfast का जो खाना है उसको cover करेगा. So mid meal, a lot of people will go and have another very high carb snack, जैसे कि biscuits हैं, या फिर they will have some chips, or they will have another snack in between, because they think कि अगर उन्होंने वो नहीं खाया तो sugar level low हो सकती है. But that is not the case. And therefore, depending on which type of insulin they are on, their meals also will differ. If they are on a regular acting or short acting insulin before a meal, then they may have to eat something maybe after 2.5 hours to avoid any kind of a hypoglycemia later on. And that meal need not be very heavy. It can be as small as just fruit with some nuts or something which is having carbs are not very, very high amount of carbs. Another thing is, a lot of people think that if you're on insulin कि वो रात को दूध जरूर पीना होता है, मतलब बेड टाइम मिल्क इज वेरी इंपॉर्टेंट और बेड टाइम स्नैक इज वेरी इंपॉर्टेंट. Again, that is not true, because depends on the different type of insulin. अगर वो rapid acting insulin पे है या फिर fast acting insulin पे है रात के खाने के पहले, and if they're on a long acting insulin at the for the basal insulin, then it is not necessary for them to take a bedtime snack if their blood glucose levels at bedtime are in the normal range. So it again depends on their glucose levels. It depends on the type of insulin they are on. And I think we today work very closely with the doctors, where we can always go back and, work towards reducing or increasing the dose if we see that the trend of blood glucose is on the higher side or on the lower side. So, today with the different newer, we have a lot of different types of insulins, and every insulin prescription will call for a different meal plan. And therefore, working very closely with a qualified dietitian would definitely help the person. And that ways we can even prevent. One is weight gain. Second is we can prevent hypoglycemia, that is low blood glucose, and we can also keep the blood glucose levels under control most of the time of the day. So I think this is very, very important and crucial.
Thank you. So there are no shortcuts to health, and insulin is definitely not a shortcut to eating junk food. So before we wind up, I would request our panelists to give a short message to our viewers. Balram sir, आप कुछ बोलना चाहेंगे अपने दर्शकों को?
Yeah, sure. So I would like to say that if you have any doubts, if you have any myths, or if you have any uncertainties or insecurities in your mind, whenever your doctor is actually prescribing insulin, then don't hesitate. Simply consult with your doctor or the diabetes educator, whosoever is there in the clinic. And I'm sure that whatever your queries are, whatever your concerns are, whatever your problems are, almost every problem, every confusion can be cleared out very easily without any difficulties. And you will actually have the benefit or advantage of insulin to your health. You can add your advantage or benefit to your health without any bother in the mind, or without any tension in the mind, because don't rely on the information which is available on the social media, which is available from the non-educated colleagues, or from the laymen, or from your relatives, because sometimes that might be partly correct, sometimes that might be wrong also. So simply rely on a trustworthy information from your doctor only. And whatever queries you have, simply ask him. And I request the treating clinicians also, doctors also, that please pay some time, attention to your patient, and everything will be easily cleared out. And if the patient is still having a lot of inertia, then we can give him or her a few days or few weeks. Again, they will visit the clinic and they will accept the insulin when the blood glucose is actually not being controlled, or they are not feeling better. So that is my own experience, what I can share you. So try to have a conversation with your doctor and your problems will be sorted out. Thank you.
Thank you, sir. संजय सर, आप बोलना चाहेंगे कुछ?
Yeah, the very short message is that the insulin is the best treatment of diabetes. So, if any doctor is starting insulin, then the patient should take the insulin. If he's having any confusion, he should ask the doctor only. He should not ask a neighbor or something like some relatives or like that. So, or other thing is that it is very inexpensive medicine. It's not expensive, particularly in India. It's very inexpensive medications. It take care of your diabetes. It take care of your diabetic complications also, and also we can get the longer life, disease-free life also with insulin.
Thank you, sir. Dr. Ajay, please. You're on mute.
Unmute.
Please unmute.
Yeah. Seniors like Dr. Balram sir and Dr. Sanjay sir have clearly mentioned every aspect of it now. So there's nothing much left. Now मेरा ये कहना होगा सब लोगों को और पेशेंट्स को कि जब भी डॉक्टर्स आपको इंसुलिन के बारे में बताते हैं, एक प्री फिक्स्ड इसमें मत जाइए कि अरे इस डॉक्टर ने मुझे अभी इंसुलिन बता दिया, मैं अभी नेक्स्ट डॉक्टर के पास जाऊंगा, जो भी मुझे ड्रग्स दे देगा वही सही है, वही ठीक है। ये प्लीज मत कीजिए, क्योंकि जो भी डॉक्टर्स आपको बताते हैं आपके हेल्थ को ध्यान में रखते हुए आपको क्या बेस्ट है वो ही बताते हैं। तो आप लोग एक प्री फिक्स्ड इसमें मत जाइएगा। जब भी डॉक्टर इंसुलिन सजेस्ट करते हैं प्लीज ले लीजिएगा। जैसे संजय सर बता रहे थे, ये लाइफ लॉन्ग होना वैसा कुछ नहीं है। अगर आपका शुगर कंट्रोल हो जाता है तो वी कैन डेफिनेटली शिफ्ट ओवर टू ओएडीज। टाइप 1 है तो इंसुलिन ही लेना पड़ेगा। तो ये सब आपको डॉक्टर्स जो भी बताते हैं प्लीज टेक इट टू योर हार्ट, और don't keep on changing or searching on the internet or doing such things. Yeah, thank you.
Cheryl, please. You're on mute.
Yeah, I think all the doctors have covered the points very, very well, and often we see that what Dr. Ajay said very rightly. The patient actually goes to another doctor because he thinks that if I go to Doctor B, he may not put me on insulin. And actually go to Doctor B and say, I was going to Doctor A, but I've come to you because he put me on insulin. So they think that insulin is a very, very dangerous thing, and it's not at all so, because that's what the friends and well-wishers will tell them. Oh my god, insulin means your one leg is in the grave. That's the kind of impression that the patient gets. And also very important is, if you are advised a certain dose of insulin, or if you're advised कि आपको इंसुलिन शायद 2 या 3 बार लेना है, तो प्लीज वो 2 या 3 बार लो, क्योंकि वो आपके लिए जरूरी है। बहुत अक्सर टाइम पेशेंट हमको बोलते हैं हम लोग सिर्फ एक टाइम सुबह ले रहे हैं, शाम का तो हम लेते ही नहीं है, and the doctor has no idea that they are not taking the insulin dose. So I think again this is very, very important, is to stay compliant to the prescription कि जो भी आपको डॉक्टर ने एडवाइस किया है is going to be good for you. एंड अगर आपको कुछ भी प्रॉब्लम है तो प्लीज आपके डॉक्टर के साथ जाके बात कीजिए. ही विल डेफिनेटली फाइंड अ सोल्यूशन फॉर यू. एंड द मोस्ट इंपॉर्टेंट थिंग इज दैट इंसुलिन, डाइट, एक्सरसाइज एंड मॉनिटरिंग, दे ऑल गो हैंड इन हैंड. तो अगर आप अपना ग्लूकोज लेवल्स मॉनिटर करोगे तो आपको पता चलेगा कि आपकी डाइट, आपका एक्सरसाइज और आपकी इंसुलिन, ये आपके शुगर लेवल को उस पर क्या असर पड़ रहा है, या फिर इज इट हेल्पिंग द ग्लूकोज लेवल्स टू इम्प्रूव. एंड ऑल ऑफ देम आर वेरी इंटरलिंक्ड, एंड देयरफॉर it is not true that if you are on insulin you can have any diet, or you should not exercise and you should not monitor. That is not true at all. So it is very important to do all the four wheels of glucose of diabetes management becomes very, very important. The four pillars of diabetes management become important.
Very rightly said. And with that, I thank all our esteemed panelists for joining us. I hope we have answered some of the questions that our viewers might have had, or busted some of the myths about insulin. And I hope that patients are more accepting towards insulin when it is prescribed to them for their own better health and prevention of complications. Thank you. Before we wind up, can I have the slides, please? So January, we are observing internationally as Thyroid Awareness Month, and Endocrine Society of India and Indian Thyroid Society are jointly organizing this interactive Facebook live session, 7 p.m. to 8 p.m. Indian Standard Time, every day of this month. Next slide, please. So stay tuned to watch more about thyroid illness, as we talk about more about thyroid illness, some of the myths about thyroid illnesses and solutions, 7 p.m. to 8 p.m. on the same platform. Thank you so much. Bye-bye.